So that's what I just click on. No? So I met Ravi in actually Oculus when we had gone to the Oculus Connect in the US. So we happened to bounce each other where most of them were talking about development and everything about which I really don't know. Really, as a doctor, I don't know about all this technology stuff. For me, how do I make my patient comfortable? Rather, how do I make his life more back to fitting back to the society is what it cares for me. So when I went, I thought I'll find some solution, but rather I did not find any solution. Rather, the only part which interested me was what you're selling now, VR for good, where UN people are creating some videos and all. So I have been doing these things for my patients, which helps essentially to go through certain situations which are very complicated in oncology. So as I said, these are mainly children who are having bone cancer. Like bone cancers are actually lethal if not treated early and picked up early. That means they're lethal. So, and if treated early, they can live like you and me. Like I have my own friend who got bone cancer and who studied orthopedics, who studied orthopedic oncology practice. He's in Italy now. But it's like that. You can have a normal life. But the word itself is so bad, or I would say the stigma has attached so much. So what has happened is, most of the people just try to get away with that. So I have been using the VR or these stuff in say patient education, like a children or a child who comes before to us. So show them some videos where the child has already gotten better, because this is a long process of care, say 6 months. So that is, so they'll prime their mind seeing some good videos of child playing a cricket, or say riding a bicycle. So all these things which it will really make him more comfortable. So that is what I am doing right now, where I generally show them the YouTube videos where it's got a VR. I use a Google Cardboard. I don't use a. So I spend some time with them, and during the treatment also. Like for example, I'll go. So I think this is altered because of the keynote issues, keynote versus PowerPoint. So some challenges, what I say is during the treatment planning, so this is the 3D model I print out before every surgery or something, so that I have an orientation of every surgery before the surgery, like doing a surgery before the surgery. So it will have a precision of surgery. So general treatment for any bone tumors is like if there is any tumor, if you in 80-90% of even in India, it's like if you have a tumor in the knee, you cut it above the knee. If you have a tumor in the elbow, you cut it here. So, but that is not the norm. Now the norm is, it is to save that area. Okay, but we are going a bit ahead to have a precision surgery. That means you take out only the tumor and leave the normal behind, so that the patient will be as normal as anybody. So that is where it helps in really planning your virtual. I mean, if I can really have I know it's pretty expensive to think also to have a virtual a 3D model like that, and turn around and cut it wherever I need and apply the same thing in my surgery. So, but 3D per se, it is helping me a lot. That's one area which I wanted to say. So this is what we did first time in India, where we did a 3D based cutting of a tumor. This is jigs we created for that particular person, because it's so cheap nowadays to get a 3D printing done. Say it's about, the whole thing costed me about less than 10,000 rupees, and it really helped the patient such big way that he can live an as normal as life as possible and less expensive. So this is how we plan. This is another thing where we can use augmented reality or virtual reality in the navigation. I think there are certain things which you probably may not like to see. Those are all the tumors. We use this navigation based. That means, like, I want to know where the tumor I'm removing. That means if the tumor is inside the body, like I would not see it there. It is on the other side of the body. I mean, so it really tells me. It will augment with the MRI scan and the CT scan and tells me where exactly I am. So combining these things, definitely we can have solutions. I mean, these are some of the things which I do it now, but I'm not will not put it across to the virtual reality. So this is what I said. And other one is some children, as I said. So she is one very, I like her very much because she's very, very active most of the times and very naughty. So when it comes to chemotherapy, she never even enters the hospital. So when I show these glasses, or probably when I show this mobile phone with the glass on, no problem. So you can do whatever with her. No? That really, see, that the connect. Nowadays, if you see, the children always would like to have a mobile phone or something. They'll keep everything. They're not bothered about what they're doing. So these are some of the things I think right now upfront applicable without much of a development. Create some good video content for the children or for the patients who are needed. Good content. I think there are a lot of content creators, and directly apply it. Cardboard doesn't cost you much. So Google Cardboard and apply directly to the hospitals wherever. And mind you, the pain medications or whatever is the drugs we give has considerably reduced with all these things. So it is not like, I always say, it is not like 1 + 1 is equal to 2. So when you tell in the mind that okay, you're not going to have pain, so generally you will not have pain. So this is what we do. This is another application. This is a Da Vinci robot, which is a widespread application with minimal invasive surgeries. Probably that can be combined with the navigation and VR. So this is one example of a boy whom we, at home care, when I send him home at second day. I don't want to keep them. In Bangalore, it's very difficult. We are from Bangalore, so it's very difficult to come to the hospital regularly So we put these glasses and make them play some good, nice videos. They would not really have any pain. You don't require to give analgesics. You don't require to give painkillers. I mean, that level it will reduce. So these are the applications which I think directly upfront is usable for the society and for the good of our causes, rather than, I thought I'll pick up certain of these issues when I went to San Jose last year for Oculus Connect, but I could not get these things. But these are things which I think right now easily should be able to do it. This is a hospital where we do all these things, and thank you for, and we as a doctors request is that we don't get connect between you guys and us. There is no marriage happening because, so I don't know what's the reason why you always, is it something like a love marriage or something probably. But as I met Ravi for a good reason, and he made me connect through these things. Good, you guys are here, probably we can all work together, and because we have a lot of things which can directly start applying, and for a good reason. Please try to get in touch with your friends who are in the medicine and get some solutions. Thanks, Ravi, for this wonderful opportunity.
So we saw one news